Hello. So, this is the back care routine that I put together almost 10 years ago now. Um, so, ugh, in 2016, I suffered a conclusion of a long-term injury, I guess you could say. I lived with spondylolisthesis most of my life. Knew about it for probably 5 years at that point, and didn't know before that if I had done a back bend, I could have broken my back very easily. I just didn't know until I went to yoga therapy school and learned that at that point. Um, but I didn't do a back bend in this case. I was just walking, but I had earlier in that year sustained a traumatic injury to my back when I was thrown against the wall. So that concluded with really not even being able to tolerate walking more than an eighth of a mile and without pain. And for months, I was searching for a solution. What was I going to do? I couldn't live with this pain for the remainder of my life. I needed to figure out what the right solution was. And while I was looking for that solution, I was still in pain. So I turned to yoga and turned to books about back pain and yoga, people, Pilates. I turned to a lot of different things and found a routine that really helped me to stay out of pain until I was able to get into surgery in December of that year. And the result of that surgery was actually quite good. Um, I when the surgery was over, I asked the doctor, "What should I do? Physical therapy?" And he said, "No, just walk as much as you want. Walk as much as you want." So I went home without a walker. Didn't feel like I needed one. Within 10 days, I walked a mile and kept walking and kept walking. And by July, I walked the Camino de Santiago in Spain, those 70 miles within 5 days. So I consider myself pretty much completely recovered. I do have back pain a little teeny bit here and there, but I know what triggers it off, and I know how to avoid those things at this point. But as a result of being a yoga therapist and being involved in all of that, um, and at about the same time, the Cochrane group, who do systematic reviews, was reviewing the idea of yoga for um, indescript low back pain. And they asked me to write a follow-on blog post about my experiences of that, which I did. And I included talking about the routine, but not the routine itself. And so through my connections with Yoga for Arthritis, I was able to then do another blog post, which was basically the routine I did and the routine that I'm going to lead you through today. In fact, I probably will post a link to this video in the comments of that very old now blog post. But things I recommend as far as books are concerned, my favorite is Rachel Krensman's book, Yoga for a Happy Back. And that is actually where we start today. So you can see I have the room set up a little bit differently than I normally do because I want to have access to a wall. And I want to do my routine in the order that it's posted online, because this actually isn't really a routine in the traditional sense of the word in yoga. It's more like yoga snacks or like individual little teeny things that you can do. You figure out what works for you in that moment and do it. If something's not working or one of these things doesn't resonate with you or with your particular situation, then you can just leave them out. Just do what works in the moment. So I'm going to start with this wall thing that Rachel did that just was like putting my back into traction and creating space in my back that was incredible in the moment. So what you're going to do is you're going to lie down on a mat. No, that music's getting loud. I don't want to compete with it. I'm going to turn it down just a little teeny bit. That feels better. You're going to lay on my back. Knees need to be bent. Feet on the wall. And you're just going to do like wind relieving pose. You're going to hold on to one of your knees as you're doing this. And then you're just going to really Press down into your back muscle body. Really try to keep a connection with the mat beneath you. And you're going to just slide and glide yourself away from the wall until your leg is straight. Now, if you've got long hair, be careful not to have it down your back because it'll slide out. Your shirt might be, your collar might be gagging you a little bit at this point, but you should notice what you're feeling in your back. Some space is being created. If you can get all the way to a pointed toe like I am, that's great. And then we're going to straighten this leg, hold it in that one hand, cradle it, and open the leg away from you. Breathing. Coming back to the middle, cross the midline of your body. Really continue to hold that traction of your back with the toe on the wall. Don't let go. Come back to the middle and then let it go. We're going to wiggle in a little bit so that we can create that traction with the other leg on the other side. So my knee is a little bit bent, wind relieving pose with the other leg. Keep that connection, slide and glide away from the wall. Adjust your shirt a little bit if you need to. And just enjoy that space created for your back. Holding the leg in one hand, open it away from you. And then bring the leg back to the middle, cross the midline. Keep holding that back. Keep that toe on the wall. Keep that traction, that space. Hold, hold, hold. And then let that go. And I did that every time. It kind of was like a nice warm up for the back, kind of like a little massage, just to kind of warm up those muscles in your back. But I want to talk a little bit about core, all of this, front, back, sides, all of your core. So I want you to think about a tree trunk. If somebody wants to cut down a tree, they cut a wedge out of one side, and that makes that side weak. So the other side is just free to fall whenever it's ready to fall. It's so all of this to say that if your back is weak and your front is strong, your back is still, it's not supporting the front of your body. Conversely, if your back is strong and your front is weak, your front is not supporting the back of the body. All of this needs to be strong. So some of these exercises are directed at the core, which is normally directed at the front, at the abdominal muscles. But if you're strong here, that takes some of the pressure off of what your back muscles need to do. And so all of that helps to hold your back. So it may seem like it's not related to your back directly, but it is absolutely directly related to your back. Some others of these, as we go through, you'll find that they're more balanced poses. But if you're doing a true balance pose, it's not just strengthening your leg. It's increasing the stability that the muscles in your core, what they can do to hold you in space. So just be thinking about that, especially with this next one. It's kind of how I think of when what I try to do when somebody tells me to engage my core. And I like to give Marlisa Sullivan credit for this, although I think she probably learned it from physical therapy school, all truth be told. So I'm going to lay down. I'm on my back again, but I want to be able to straighten my legs out. So I'm going to be a little bit further away from the wall at this point. But then I'm going to bend my knees, feet flat on the floor. And we're going to think in terms of line segments. That's going into geometry. A line that has two dots, two endpoints of it. And we're going to find 3 line segments in the body. The first one is from your right sitting bone to your left sitting bone underneath of you. So if you imagine that as a line segment from buttocks to buttocks, then I want you to shorten that line segment. I want you to make it shorter. from the right sitting bone to the left sitting bone. You're making that line segment shorter. And then let it go. So I want you to take your hands and just rest them on your abdomen and just breathe. Let the line segment go and just breathe. And really try to take deep abdominal belly breath. Feel the abs moving in and out as you breathe in and out. Deep diaphragmatic breath. Diaphragm moving up and down. And now engage that line segment. Sitting point to sitting point. Sitting bone to sitting bone. And notice what happens as you try to take these deep breaths. You start to hit up against a wall of abs. But we're going to make it even tighter. So from the pubic bone on the front of your body, straight through your body to the tailbone behind you. That's the second line segment. So try to move your pubic bone and your tailbone closer to each other, while at the same time, the sitting bones are moving closer. It's pubic bone, tailbone, sitting bone to sitting bone. They cross each other in the body. So you're basically moving into the center of your pelvic floor. And for women, this is a Kegel. For men, welcome to the world of Kegels. So now go back to those abs, and notice as you're holding these two line segments, if you're still able to make those abs move in and out with the diaphragmatic breath, it probably is a little bit harder still. But I want you to notice how, with these muscles being held tight in the front, how stable the back might feel. So the third line segment, hip point to hip point on the front of your body, those little knotty, bony landmarks that stick out at your hips. One on the right and one on the left. So you're going to move them into the center too. So we've got sitting bone to sitting bone underneath of you moving in, pubic bone to tailbone moving in, and then hip point to hip point moving in. And if your back hurts at all while you're doing this, immediately take the front edges of your ribs and tuck them down towards the ground. That's the last little bit. And notice how strong your abdominal muscles feel as you're doing all of this. It should feel nearly impossible to breathe over top of this. This is not a way to breathe. This is an exercise. You shouldn't walk around trying to hold like this all the time because it's really hard to breathe. But for those for whom that have strong abdominal muscles and want to go a little bit further, you can hold all of that while lowering your leg for 2 breaths. And then raising it back up for 2 breaths. And if you're holding correctly, this should be almost easy to do. And then repeat that 2 more times on this side, a total of 3. See, it's hard to talk because you can't breathe real well when you're doing this. But think about how much good you're doing for your abdominal muscles, and you're not having to do a sit-up to accomplish it and then move on to the other leg, because a sit-up in this kind of a situation might actually not be comfortable for you to do because of the back pain. So we're going to move on to something else for that when we finish this. After you finish your third up and down with the leg on the second side, holding your line segments, then let it go. And take a couple really deep breaths, like a counter pose for the abs. Just let all that go. So something I got from Pilates we're going to engage with now. This is sort of a crunch, but not exactly. So a traditional crunch, we would do our arms like this with the elbows way out. But right now what we're going to do is bring your elbows in close. So you're making more or less a hammock for your head. And then what I'd like you to do is to engage those line segments again, sitting bone to sitting bone, pubic bone to tailbone, hip point to hip point, ribs down. And then not from the head, but from the abs, lift the head. and maybe hold it there. Let the arms just be a hammock for the heads to help prevent the head from doing any work. And you're just going to do a static hold of the head. Woo-wee. And when you're ready, you can let it come back down. So you can, that big abdominal breath again. You can repeat that as many times as you want. You may only be able to do one when you're starting, but then over time, maybe you can do some more. All right. Sorry, I have a little cheat sheet here because I do want to make sure I'm doing everything. So we're going to lay back down now and do supine figure 4 pose. So I'm going to take my right ankle and place it on my left knee. You can all see that. Right ankle on left knee. And then I'm going to pull with the left leg. I'm going to pull the right leg into my body. I'm going to take my hands underneath of that left leg. My right elbow, I'm going to put it on my right knee and try to hold the right knee open as I'm pulling the legs into your body. So this is a forward folding, which probably feels really good for the low back. It's stretching the low back, crunching the front of the body, putting the front in flexion and putting the back in extension. Doing a back bending actually puts the back into flexion. And then we'll move on to the other side. Remember, now your other elbow, your left elbow, if you're on the same side as me, is holding the left knee open. Breathing. Check my cheat sheet. So Yoga for Arthritis is really into coming back to the center. You can do something unilaterally on one side of your body, but then you need to come back and do something bilaterally, both sides. So we're going to do happy baby pose here, just to kind of reset the back, reset the hips, reset the abs. You can just like massage your back with your legs open, rolling around in a happy baby pose. And then I'm going to grab a block. I want it somewhere within my reach for this next one. We'll come back to a better alignment here. So we're going to go into an unsupported bridge pose. I'm going to lift my hips up. I would like you to have your legs together and your feet together if you can. Squeeze, squeeze, squeeze. Squeeze the buttocks. Sitting bone to sitting bone. Pubic bone to tailbone. Hip point to hip point. All of that squeezing. And out of all of that, this should become actually easy. And if it's not quite easy, we can make it a restorative pose for a little bit. So you're going to take the block and put it just above the crack of your buttocks, right at your tailbone. If it's on your waist, it's too high up. And you can make the block low. I've got it on medium here. You can make it tower it to tall if you want. And then just rock the knee side to side a little bit. It's like a little low back massage. Your back just needs that additional massage. You could do the push away from the wall that we did at the beginning and this together as a little bit of a massage. And then when that feels complete, you could stay longer if you like. We're going to roll down again. I'm going to do a little knees into chest, roll around. We're going to roll over prone. So this has two choices. You can either do a plank, or you can do wall push-ups. If you're feeling good, go ahead and do a plank. Legs together, but squeezing all of those abs engaging, all those line segments engaging. Hold, hold, hold as long as you can. And when you can't hold it any longer, chaturanga, or a tricep lowering part of the push-up to the ground. So let me show you, if you're having a bad day, you'd go to the wall, hands on the wall, and just do some, try to keep your triceps in close to yourself, and just do some wall push-ups. Try to engage that core as you're doing it. Maybe think about it, even if you're in pain. So that's the easier option for a bad day. The next, and then there was one in here that I've since taken out. It's called prone decompression. You can look it up under foundation training if you are interested in it. I have found it actually to cause me more pain in the long run. It was helpful for a little while, but then it started causing more pain. It's sort of like a prone Superman, except that the front hands are on the ground and they're kind of like this, and you keep moving them away from your body. And the shoulders are down and back, kind of. It's odd, and I just don't endorse it anymore. So I'm going to leave that one out. The next one, any physical therapist is going to have you do this. And this is the first one that's going to start working on core stabilization. And it's going to be a balance pose. It doesn't seem like it, but it is. So this is bird dog. So you're quadrupled on your hands and your knees, and you want your wrists to be under your shoulders. You don't want your wrists to be way out here. That's going to really hurt your shoulders. So don't do that. I'm going to grab where my mats are overlapped just for a little extra cushion under my knee. And then I'm going to, whoops, I can't do it. I got to go over here. Then you're going to extend one leg out, but you don't want the hip to be open like this. You want the hips to be parallel with the ground, wrists under shoulders. And if you feel like you need a little additional support, if it's a little bit too unsteady, you can tuck your back toe rather than having it flat. So that's a choice you can make. See my toes that are down? You can choose. I'm going to keep them tucked for a moment. And then my opposite hand, right now I've got the leg that's closest to the camera up. So the hand that's furthest away, I'm going to extend that out. If I flatten this out, the toe out, it feels really like I have to pull those line segments in, all those line segments, pull them in to hold the stability. And then you can do knees and elbows together. You can also just wiggle and really try to throw your balance off. If you've been tucking your toe, try to flatten your toe out and see how that changes. The idea here is to have all of these muscles here stabilizing you. And then move over to the other side. Same things. You can do elbow to knee. You can try to throw your stability up. You can do all of this in sets too. You can do like repeating this 5 times, go to the other side, come back, do 5 again on each side. Try to throw your stability off. Try to knock yourself over, so to speak, with your balance. What can you do? How can you throw it off? I don't know about you guys. It's not in here, but I need a child's pose for a second. So that's choice. Always a reset choice of child's pose. The next pose is goddess pose. Another one is like, why are we doing this? It's all about throwing your balance off. So we're going to take our knees out wide. Come off of your heels if you can. I like having a wall here just in case I need it for my stability, but then engage. Sitting bone to sitting bone, pubic bone to tailbone, hip point to hip point. Woo! And all of a sudden, everything is easy. Really, really engaging there. And if you need a break, you can bring the heels down. It's really quite up to you. Ooh. Hold that for as long as you want, then take a little break. All right, low lunge, crescent pose. So I'm in a low lunge, and you can take the arms up, or you can have them down. It's not really about the shoulders, so you can actually have your hands on your knee if you want. So this is like a nice stretch after all that work you've done with your pelvic floor, believe it or not. And then backing off of that, maybe straighten that front knee. And then moving to the other side. So you notice these aren't super long holds. There may be 5 breaths, but you can hold them longer. It's up to you. I'd say 5 breaths would be the minimum. I do in holding any of these. And then we're going to come to standing in mountain pose. Mountain pose is another reset pose, coming back to bilateral stability. Both sides of the body working together. Before we do the gold standard yoga pose, tree pose. So try to have you can have your toe on the ground if you need that, or at the calf, or maybe all the way up the groin if you so desire. It's up to you. And my little routine is then the branches grow. Then your big old oak tree. We're in Georgia here, so the kudzu comes along. I got my hands intertwined. And then the wind comes along, straight line winds. And just trying to throw my balance off a bit here. So you choose. I'll do this on my lower leg this time. You choose where you want your foot to be, but not at your knee. Try not to be at your knee because there's ligaments there. Throw that balance off. Pull back to those core muscles to help stabilize not just your core, but your back as well. Yeah. All right. So your tree pose. The last thing that I would do, and this is especially, it kind of comes out of all the walking I did and how much benefit I got from that. The reason that walking works is the same reason walking works for somebody that has osteoporosis. When you have back surgery, a lot of times they put bone grafting material in your back to help you fuse naturally two of your vertebrae together. So you're trying to grow bone, much the same way that somebody who has osteoporosis is trying to make their bones denser. You're trying to do the same thing. So walking is an important thing. So I started kind of doing this, and my chair that I meditated on was away from this wonderful wall I have here. It's in the other room. So I would just kind of do this crazy bent knee stability walk, just to try to throw my balance off. Try to, just try to throw it off and just try to work with building bone through walking when I couldn't walk a whole lot. And then when we get to this spot, we're going to down dog just to get yourself out of gravity, upside down. Take a down dog. If you have a inversion table, this would be a great spot to use an inversion table. If you can do a handstand, not a headstand, that would be a good spot to put a handstand in as well. Whew. And now we're just going to do a relaxation response meditation. It's very, very fast. And I learned this from the Benson Henry Institute out of Harvard Medical School. where they've studied the relaxation response since the 70s. And this is like a very, very simple, adaptable meditation that you can do. And it works with breath. It starts very simply with 2 words. As you breathe in, think about the word in. And as you breathe out, think about the word out. So let your eyes close if you're comfortable with that. And if you're not, maybe just find some spot to use as a single point of meditation. And just think about in as you breathe in and out as you breathe out. In and out. In and out. In and out. Next, as you breathe in, think about the word deep. And as you breathe out, the word slow. Deep and slow. Deep, slow. Deep, slow. Next, as you breathe in, think about the word calm. And as you breathe out, the word ease. Calm, ease. Calm, ease. Calm, ease. Next, as you breathe in, smile. And as you breathe out, release. Smile, release. Smile, release. Smile, release. Next, as you breathe in, present. And as you breathe out, moment. present, moment. Present, moment. Present, moment. And lastly, as you breathe in, wonderful. And as you breathe out, moment. Wonderful, moment. Wonderful, moment. Wonderful, moment. And then next, I'd like you to invite you to use any 6 of those combination of words that might have resonated with you, or come up with your own. And here's a few suggestions that worked for me. Happy on inhale and back on exhale. Strong on inhale, back on exhale. Pain on inhale, free on exhale. Anxiety on inhale, free on exhale. Om on inhale, or Shanti, which means peace, on exhale. Or peace on inhale and peace on exhale. Those or any others, any 2 words that work for you, work here. You just take a few more breaths. And when that feels complete for you, softly opening your eyes, taking the hands down, touch the earth. Inhale the arms up, bringing the palms of the hands together. Exhale the hands down to your heart. Eyes closed, head bows. Take a deep breath in and out. Eyes open, head lifts. And namaste. Have a happy back. Have a happy day.